Hello, everyone. Thank you for joining us this month. Our presentation for National Breast Cancer Awareness Month will cover breast cancer risks, prevention, and screening. We will be covering the topics of what is breast cancer, what are the risk factors for developing it, and what should I watch for as far as signs and symptoms, and what is in my power to prevent it. We will also cover different recommendations out there for screening for early detection. Okay, so what is breast cancer? Breast cancer is a malignant tumor that starts in the cells of the breast. A malignant tumor is a group of cancer cells that can grow into or invade surrounding tissues or spread or metastasize to distant areas of the body. Most breast cancers can begin in the cells that line the ducts, and those are called ductal cancers, but some begin in the cells that line the lobules, and those are called lobular cancers. There are a small number of breast cancers that also start in other tissues. But this disease occurs almost entirely in women, but men can get it too. Breast cancer is the most common cancer among American women, except for skin cancers. About 1 in 8 or 12% of the women in the United States will develop invasive breast cancer during their lifetime. In the United States in 2011, there were over 220,000 women diagnosed with breast cancer and almost 41,000 women that died from the disease. According to the Centers for Disease Control, breast cancer is the most common cancer among American women, and there were also 2,078 men diagnosed and 443 men who died from breast cancer. Simply, being a woman is the biggest risk factor for developing breast cancer. While men can develop breast cancer, it's far less likely because men have less of the female hormones estrogen and progesterone, which can promote breast cancer growth. Your risk of developing breast cancer increases as you get older. About 1 in 8 invasive breast cancers are found in women younger than 45, while about 2 of 3 invasive breast cancers are found in women age 55 or older. About 5 to 10% of breast cancer cases are thought to be hereditary, resulting directly from gene defects called mutations inherited from a parent. Certain inherited DNA mutations can dramatically increase the risk for developing certain cancers and are responsible for many of the cancers that run in some families. For example, the breast cancer or BRCA genes, BRCA1 and BRCA2, are tumor suppressor genes. They help to repair damaged DNA. A mutation in one of these genes can be inherited from a parent, and when one of these genes are mutated, it no longer suppresses abnormal growth, and cancer is more likely to develop. For more information on this, you can find a fact sheet on the National Cancer Institute online. But having a blood relative, a mother, grandmother, sister who had breast cancer has been shown to increase your risk of breast cancer. Also, the use of alcohol is linked to an increased risk of developing breast cancer, and the risk is increased the more alcohol is consumed. And being overweight or obese after menopause increases breast cancer risk also, because before menopause, your ovaries produce most of your estrogen, and fat tissue produces a small amount of estrogen. But after menopause, when the ovaries stop making estrogen, most of the women's estrogen comes from fat tissue. So having more fat tissue after menopause can increase your chance of getting breast cancer by raising estrogen levels. A woman with cancer in one breast has a much higher risk of developing new cancer in the other breast or another part of the same breast. White women are slightly more likely to develop breast cancer than our African American women, but African American women are more likely to die from this cancer. However, in women under 45 years of age, breast cancer is actually more common in African American women. Asian, Hispanic, Native American women have a lower risk of developing and dying from breast cancer. Studies have found that women using oral contraceptives or birth control pills have a slightly greater risk of breast cancer than women who've never used them. This risk seems to go back to normal over time once the pills have stopped. Women who have had no children or who had their first child after the age of 30 have a slightly higher risk of breast cancer. There's a growing evidence also that physical activity in the form of exercise reduces the risk of breast cancer, and some studies suggest that breastfeeding may slightly lower breast cancer risk, especially if continued for 1.5 to 2 years, but this has been a really difficult area to study because in the United States, breastfeeding for this long is pretty uncommon. Now that we've covered risk factors for breast cancer, let's talk about the signs and symptoms to keep an eye out for. It's important to remember that all lumps should be investigated by your doctor, but not all lumps are cancerous. A lump in or near the breast or underarm should be checked by your doctor. The first apparent symptom of cancer may be a lump that persists after your menstrual cycle. A lump that is painless, hard, and has irregular edges is more likely to be cancerous. You may also experience swelling in the armpit. Pain or discomfort in the breast may occur. You may notice changes to your breast or nipple. There may be an indentation or flattening on the breast, which could indicate a tumor. Pay attention to changes in temperature, size, texture, and report any abnormal findings to your doctor. There may also be peeling or scaling or flaking to the breast, skin, or nipple area. You will want to watch the nipple for retraction or turning inward and any nipple discharge or if it becomes itchy or you develop a burning sensation. The American Cancer Society releases recommendations for cancer prevention about every 5 years. They include general recommendations as well as recommendations specifically for healthy eating and physical activity. Now, we already went over the risk factors, so evaluate yours and discuss a plan with your doctor. General recommendations for prevention include not smoking, maintaining a healthy weight. It's recommended that you eat healthy, exercise, and limit alcohol consumption. Now, we're going to go over in a few minutes more about healthy eating. Sandy, our dietitian, will go over that. But with regards to alcohol consumption, it's recommended that you drink no more than 1 drink per day for women or 2 drinks per day for men. Now, Sandy will go over some nutritional information.
Great. Thanks, Dawn. By eating healthy, you can manage your weight. And as Dawn mentioned earlier in the presentation, being overweight after menopause increases breast cancer risk because most of a woman's estrogen at that time comes from fat tissue. Having more fat tissue after menopause can increase your chance of getting breast cancer by raising estrogen levels. So eating a healthy diet with an emphasis on plant foods is especially beneficial. Plant foods are rich in phytochemicals, and I often refer to phytochemicals as fighting chemicals. Phytochemicals protect plants against bacteria, fungi, viruses, and cell damage. And the same phytochemicals that protect plants also help the humans who eat them. Phytochemicals are found in plant-based foods such as fruits, vegetables, beans, and grains. And it's important to note that available scientific evidence does not support claims that taking phytochemical supplements is as good for long-term health as consuming the fruits, vegetables, beans, and grains directly. When choosing grain foods, choose whole grains instead of refined grain products. A few examples are 100% whole grain breads and cereals, oats and oatmeal, brown rice, millet, and quinoa. When choosing dairy products, choose fat-free or low-fat 1% dairy products, and try to limit red meats and processed meats as much as possible. Choose leaner proteins such as chicken, fish, or beans more often. You also want to limit saturated and trans fat, and these are found in foods such as red meat, fatty deli meats, poultry skin, full-fat dairy, fried foods, margarine, donuts, and even microwave popcorn. Limit foods that contain trans fats. Another name for trans fats is partially hydrogenated oils. And food companies like using trans fats in their foods because they're inexpensive to produce, and they can also extend the shelf life of many products and also give food products a desirable taste and texture. A product label can say no trans fat if the amount of trans fat in one serving size of that item contains less than a half gram of trans fat. So remember that small amounts can add up quickly, so it's important to read the food label and look for the words partially hydrogenated oils in the ingredient list of the food label. And try to eat less or none of these foods that contain these words in the ingredient list. Replace saturated fats with polyunsaturated and monounsaturated fats. And poly and monounsaturated fats are found in foods such as olive oil, nuts, and natural nut butters, avocado, and olives. And limit added sugars. Added sugars are simply empty calories that don't provide any nutrients. And servings and serving sizes are always important as well. Choose foods and drinks in amounts that will help you get what you need to maintain a healthy weight. And a great resource for detailed information on a healthy diet is choosemyplate.gov. And although soy has gotten the bad rap in the media, it is important to note that soy can be part of a healthy diet. Soy foods such as tofu, tempeh, edamame, miso, and many veggie burgers and other products made with soy contain what we call isoflavones, which are chemically similar to estrogens. Two major types, genistein and daidzein, can act like estrogen in the body, although at a very small fraction of the potency of circulating free estrogen in women. These effects can be good or bad. It is well established that estrogen is linked to hormonally sensitive cancers in women, such as breast and endometrial cancer. Breast cells contain estrogen receptors, and when the key, being estrogen, joins with the lock, the estrogen receptor, a series of signals are sent which can spur on estrogen receptor positive breast tumor growth. However, most of the concern about soy has come from studies in laboratory animals. Rats injected with these types of tumor cells were given varying doses of soy isoflavones. Those given more of the isoflavones had a greater growth of the breast tumors compared to rats given little or no isoflavones. But not all animal studies have shown harmful effects. And soy is metabolized differently in humans than it is in rats and mice, so findings in rodents may not apply to people. Epidemiological studies in which large populations of healthy women have reported details about their usual diet and were followed for many years have either shown no association between soy and breast cancer or a protective association, meaning that people who ate more soy had less breast cancer. The 2012 American Cancer Society Guidelines on Nutrition and Physical Activity for Cancer Survivors, which was written by a panel of experts, including researchers with expertise in this area, concluded that current research finds no harmful effects to breast cancer survivors from eating soy. Both the guidelines for cancer prevention and the guidelines for survivors recommend against taking soy supplements because they contain much higher isoflavone concentrations than what you would normally find in the foods you eat. They haven't been as rigorously tested, and they may have other potent effects on body tissues.
Thank you, Sandy. Now we'll talk about physical activity. The American Cancer Society publishes the Nutrition and Physical Activity Guidelines for Cancer Prevention, and these guidelines are published about every 5 years, and the guidelines are consistent with the guidelines from the American Heart Association and the American Diabetes Association for the prevention of coronary heart disease and diabetes, as well as for general health, defined by the Dietary Guidelines for Americans, and also the 2008 Physical Activity Guidelines for Americans. So doing some physical activity above your normal everyday activities, no matter what one's level of activity may be, can have many health benefits. It's recommended to get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity each week, preferably spread throughout the week. So really just try to limit your sedentary behavior, such as sitting, lying down, watching TV, and other forms of screen-based entertainment. I'm going to cover recommendations from different organizations. The United States Preventive Services Task Force recommends against routine screening mammography in women aged 40 to 49. The decision to start regular biennial screening mammography before the age of 50 should be an individual one and discussed with your physician, including the patient's values regarding special benefits and harms as well as their potential risk factors. Of over 1,000 mammograms, only 2 in 4 lead to a diagnosis of cancer. However, the U.S. Preventive Services Task Force recommends biennial screening mammography for women aged 50 to 74. The reason behind this is that false positive test results, overdiagnosis, and unnecessary earlier treatments are problems for all age groups. False positive results are more common for women aged 40 to 49, whereas overdiagnosis is a greater concern for women in the older age groups. For self-breast exams, according to this organization, adequate evidence suggests that teaching breast self-exam does not reduce breast cancer mortality, and that unless you're taught how to perform this by your clinician, it can cause more harm than good. The task force bases its recommendations on the current evidence about preventive services. Recognizing that science and medicine are constantly advancing, they update recommendations on a regular basis about every 5 years, and they're in the process of updating breast cancer screening recommendations this year, so we'll see if any of these recommendations change. Now, the American Cancer Society has their own recommendations, and they feel that women age 40 and older should have screening mammography every year and should continue to do so as long as they're in good health. Current evidence supporting mammograms is even stronger than in the past. In particular, recent evidence has confirmed that mammograms offer substantial benefits for women in their 40s. Women can feel confident about the benefits associated with regular mammograms for finding cancer early. However, mammograms also have limitations, and a mammogram will miss some cancers, and it sometimes leads to follow-up of findings that are not cancer, including biopsies. So women should be told about the benefits, limitations, and potential harms linked with regular screening. Mammograms, as I said, they can miss some cancers, but despite their limitations, they remain a very effective and valuable tool for decreasing suffering and death from breast cancer. Mammograms for older women they should be based on individual, her health, and any other serious illnesses such as congestive heart failure, end-stage renal disease, COPD, which is chronic obstructive pulmonary disease, and moderate to severe dementia. But age alone should not be the reason to stop having mammograms. As long as women are in good health and would be a good candidate, she can continue to be screened. Now, women in their 20s and 30s should have a clinical breast exam as part of their periodic regular health exam by a health professional, at least every 3 years. And then after the age of 40, women should have a breast exam by a health professional every year. Clinical breast exam is a complement to mammograms and an opportunity for women and their doctors or nurses to discuss changes in their breasts, early detection testing, and factors in the woman's history that might make her more likely to have breast cancer. There may be some benefit in having a clinical breast exam shortly before the mammogram. The exam should include instruction for the purpose of getting more familiar with your own breasts. So women should also be given information about the benefits and limitations of clinical breast exam and breast self-exam. Breast cancer risk is very low for women in their 20s and gradually increases with age. Women should be told to promptly report any new breast symptoms to their health professional. So you should be having these discussions with your doctor or your clinician. Breast self-exam, research has shown that breast self-exam plays a small role in finding breast cancer compared with finding a breast lump by chance or simply by being aware of what's normal. Some women feel very comfortable doing breast self-exams, usually monthly after their period, which involves a systematic step-by-step approach to examining the look and feel of your breast. Other women are more comfortable simply looking and feeling at their breasts in a less systematic approach, such as while showering or getting dressed or doing the occasional thorough exam. Now, sometimes women are so concerned about doing it right that they become stressed over technique. Doing breast self-exam regularly is one way for a woman to know their breasts, how they normally look and feel, and to notice any changes. So really the goal, with or without a breast self-exam, is to report any breast changes to your doctor or nurse right away. Women who choose to do a breast self-exam should have technique reviewed during their physical exam by the health professional. And it's okay for women to choose not to do a breast self-exam or not to do it on a regular schedule. However, by doing the regular exam, you will get to know your breasts and how they normally look and feel, and you can more readily detect any signs or symptoms if a change occurs, such as development of a lump or swelling, or skin irritation, or dimpling, or nipple pain, or retraction, or any of the signs and symptoms that we talked about. Should you notice any changes, you should see your healthcare provider as soon as possible for them to evaluate. Remember that most of the time, these breast changes are not cancer. If you're interested, you can download a shower card describing how to do a breast self-exam from the National Women's Health Resource Center website. According to the American Cancer Society, women at high risk for breast cancer, based on certain factors, should get an MRI and a mammogram every year. Now, this includes women who have a lifetime risk breast cancer of 20 to 25% or greater, which is according to a risk assessment tool that's used. That's based on mainly family history. So having a known BRCA1 or BRCA2 gene mutation, having a first-degree relative like a parent, brother, sister, or child with the mutation if you haven't been tested yourself, and if anyone who has had radiation therapy to the chest when they were between the ages of 10 and 30. Also, certain syndromes put you at higher risk. Leigh-Fermani syndrome is a rare disorder that greatly increases the risk of developing several types of cancer, particularly in children and young adults. And Cowden syndrome is a disorder characterized by multiple non-cancerous tumor-like growths called hematomas and an increased risk of developing certain cancers. And then there's benign Riley-Ruvalcaba syndrome, which is a genetic condition characterized by a large head size, multiple non-cancerous tumors or tumor-like growths. And the signs and symptoms of this condition are present from birth and become even more apparent early in childhood. And so risk, having any of these syndromes puts you also at higher risk. So the U.S. Preventive Services Task Force concludes that current evidence is insufficient to assess additional benefits and harms of either digital mammography or MRI instead of using film mammography. So really, if you have any questions or concerns about whether MRI is right for you, please talk to your doctor. And these are the resources that were used for this presentation. And really, if you want to do any of your own research, go on the American Cancer Society or CDC or U.S. Preventive Services Task Force websites and do additional research and talk to your doctor about any questions that you have. As always, our health coaches are available to assist you with any health goals you wish to work on for yourself, including those that may put you at reduced risk for breast cancer. So I hope that you enjoyed this presentation. This will now bring us to an end, and I thank you so much for joining.